Hi there. I would like to take this time to present to you my findings on STD rates in Maryland, particularly Baltimore City. STD rates in Baltimore City are extremely high and are continuing to rise. For this presentation, I chose to focus on the teenage and adolescent populations, ages 15 to 24. According to the research, this is the population that is mostly affected by this subject matter. Teens and adolescents that are sexually active are at a higher risk of being diagnosed with an STD than older adults. Younger people engage in risky sexual behavior, which can lead to an increased risk of HIV infection, other sexually transmitted diseases, and unintended pregnancy. There are some identifiable barriers which may impact STD prevention and management. They are the inability to pay for services, lack of transportation, long wait times at the clinic, conflicts between clinical hours and work or school schedules, embarrassment associated with seeking STD treatment, method of specimen collection, and concerns about confidentiality. This was recorded by the CDC. Adolescents ages 15 to 24 account for nearly half of 20 million new cases of STDs each year. This presentation focuses on STDs, but I would like to bring some attention to HIV infection. HIV, sexually transmitted in nature, was estimated to have about 1,347 adults and adolescents diagnosed with the virus in Maryland. When you break it down by race, African Americans were the highest with HIV infections, with a percentage of 75.9% of HIV cases. Whites had 12.9%, Latinos with 7.3%, mixed race with 2.3%, and Asians with 1.3% of cases. Then the question becomes, who is at risk? Well, everyone, especially those who don't practice safe sex. But men who have sexual relations with other men and women are said to be more vulnerable to contracting an STD or HIV infection. One reason why STD rates are high is because most people don't know they have the infection. Symptoms of chlamydia and gonorrhea don't appear right away. Symptoms can be mild and oftentimes confused with another infection. People with chlamydia may not see signs of infection for several weeks. There have been cuts on STD screenings and marketing campaigns. People are hearing fewer messages about safe sex and condom use. On the other hand, there are some efforts being made to change this in Maryland. Baltimore health officials are increasing hours at 2 STD clinics, and there are mobile vans that travel the city to offer free testing. The health department is also working with the CDC to get more information from people who test positive for an STD to help them better understand how these infections spread. Now, here are some stats on the STD rates in Baltimore City. Baltimore City ranks the 18th worst in the country when it comes to STD rates, says the Maryland Health Department. In 2016, rates of chlamydia were 1,192.1 per 100,000, compared to the entire state of Maryland at 509.6 per 100,000. In the same year, rates of gonorrhea were 569.8 per 100,000, which topped Mississippi rate, a state that used to hold the worst position in the country. Here you see how rates of chlamydia and gonorrhea compare in Baltimore City with the state of Maryland, Maryland counties, and the U.S. Rates in Baltimore City exceed the other areas. One thing to note is that gonorrhea incidence rates have increased dramatically within the last few years, while chlamydia rates are high but remain somewhat stable. So, who plays a part in all of this? Stakeholders. Stakeholders are entities that are integrally involved in the healthcare system and would be substantially affected by the reforms to the system. For the sake of this presentation, the stakeholders I identified are the teens and adolescents themselves, parents, doctors, nurses, social workers, health insurance companies, pharmaceutical companies, Maryland Health Department, state local legislators, policymakers, schools, teachers, educators, and churches. I use this influence diagram to show the relationship between stakeholders and how they impact each other. First, it starts with the teens and adolescents or the patients. From there, the patient will inform their parents that something is wrong. In this case, they believe they've been infected with an STD. From there, the patient will go to the doctor along with the parent to get tested. During this visit, the patient and parent will interact with the doctor and the nurse, and even the social worker on educational pieces about safe sex and condoms. The social worker may also want the names of the persons the patient had sex with to call them in for testing. Then, the doctor bills the insurance company for the visit and prescribes the medication for treatment, which comes from the pharmaceutical company. The Maryland Health Department collects data on STD incidence rates and receives claims data from the health insurance and pharmaceutical companies. State and local legislators review the data and work with policymakers to pass legislation and put programs into play related to STD education and prevention. Once these are put into place, they are disseminated to the schools and churches where teachers and educators are able to pass the information to the youth. The reason for all of this is to increase awareness about STD, HIV diagnoses, and prevention. I want to bring back campaigns that talk about safe sex and condom use. I want to implement sex education curriculum in middle and high schools and have them taught by experienced and trained health professionals. I hope that this data analysis will encourage parents to talk to their children and open the conversation about practicing safe sex, and for children to get tested if they suspect they have contracted an STD. And lastly, make STD and HIV testing readily and easily accessible, provide more mobile units for free testing, and offer testing at schools. Thank you for taking the time to listen to my presentation. I hope this sparks a conversation to help our young people practice safe sex and prevent contraction of STDs. At the end of this presentation, attached is an infographic I created, a visual tool that will draw the attention of teens and adolescents to read and understand how STDs are affecting their neighborhoods. Thank you.